Good morning to one and all present here. Absolute pleasure to be standing here and presenting my topic, which is a study of refractive errors and central corneal thickness in patients of VKC. So it's been said when you see a child suffering from a severe form of VKC, you feel the dearth in the knowledge. Because however common the disease may seem, but there's still mystery around VKC. For example, recently it's been found that there are abundance of estrogen and progesterone receptors in conjunctiva of VKC. So there's dearth of knowledge. Also, I would like to focus on two words here, morning misery, because बाकी बच्चे गर्मी की छुट्टियों में मस्ती करते हैं, खेलते हैं, ये बच्चे आंख मलते रह जाते हैं. But it's just about ocular discomfort or it's about more. So let's try to find out. We did this study with 40 cases and 40 controls, and we find out the mean spherical error, mean cylindrical error, and central corneal thickness, and similar number of controls were taken, and then we compared the data. So fine Saturday morning, no one wants to hear random babbling of numbers from a junior resident. So I'll keep it crisp. Most of the cases of VKC had the most common refractive error seen among them was simple myopic astigmatism, and among controls it was simple hypermetropic astigmatism. We can see the prevalence here. And then most of the cases had power in the range of, spherical power in the range of 0 to plus 0.25 diopter, and same in controls also. But when we see cylindrical error, it comes to a little negative side, minus 0.5 diopter to minus 0.25 diopter in cases, and it was on plus side in control eyes. Now, when we see the mean cylindrical error and mean CCT and control among, and when we compare, we find a significant difference. But among mean spherical error, there was no significant difference in cases and controls. And then but here's a catch. There's a catch in that. When we compare the spherical error among recurrent cases and control, then we find a significant difference, and whereas in mean cylindrical power and mean CCT also we find a significant difference in recurrent cases and controls. But when we come to first time occurrences, when we see the first timers, we see no significant difference between the two. So we can say that VKC has a temporal association with the spherical errors. And further dividing VKC into groups according to types, bulbar, palpebral, mixed, we saw that bulbar VKC has no significant difference in any of the parameters, whereas palpebral and mixed did. So we can say that might be the palpebral hyperplasia or the cobblestones or macropapillae may be a culprit in the disease, what are causing the refractive errors and thinning of the cornea. Coming to the discussion, we saw that most of the cases and also the controls had power in the range of 0 to plus 0.25 diopter, and this is according to the standard Standstorm study from Uppsala, which also says that most of the population is either emetropic or hypermetropic. Also in our study, the maximum number of cases had cylindrical power in the range, as we talked about, slightly on the negative side, but mild astigmatism. And in the study done by Zhang et al. Also, mild astigmatism was the most prevalent among all the reported astigmatism case. Now, the thing we talked about before also, there was no difference in spherical power of cases and control overall, but when we saw the recurrent cases, we found that there was a difference. Why so? We said that there might be a temporal association, but in a study done by Mimura et al., what they said that myopia is a risk factor for allergic conjunctivitis. VKC also being an allergic conjunctivitis, but what we saw here was recurrent cases had a spherical error slightly towards the myopic side, whereas new cases did not. So our results are slightly contradicting their study. We are saying that VKC is a risk factor for myopia and not the other way around. Coming to the cylindrical power, what we saw was new cases had no difference, had no effect on cylindrical power, but the recurrent cases did have. So it might be that recurrence has an effect on the cylindrical power, and the longer the disease, the more the effect. Now, VKC also led to central thinning, and various studies have also reported that, like one from Ondas et al. From Turkey. They also find the same, and with ultrasonic pachymetry. Now, discussing about, again, we are saying the same thing. Since new cases have no significant effect on spherical power, but recurrent cases do have, this leads us to the conclusion that VKC has a temporal association with myopia, and VKC is a risk factor for myopia and not the other way around. Same thing about cylindrical power, new cases, no effect, recurrent cases did have, and similar findings were seen in a study by Dentos et al., which suggests that disease chronicity could be related to the severity of the corneal ectasia. Now, significant difference on mean central corneal thickness between first time and recurrent cases. Same thing said by Kim et al. That persistent and chronic corneal trauma on the corneal epithelium induces a silent and chronic inflammatory process, with more biomechanical resistance, more difference. Now, now what we saw in table number 6 was that bulbar VKC didn't have much effect on the refractive power and central corneal thickness of the patients, but palpebral and mixed did have. This may be due to the fact that the cobblestone, the macropapillae, maybe they are causing all the, they have the role in the pathogenesis. Maybe they are the culprit. That's why mixed and palpable forms have significant difference in central corneal thickness and cylindrical error. Same thing we discussed, mixed VKC cases versus controls. And in a study by Abledavi et al., they compared the mean CCT, the minimum CCT, and found the same thing. So our conclusion is simple myopic astigmatism was the most common refractive error seen among VKC patients, while this study throws light on the deleterious effect of VKC, such as thinning of cornea, induction of myopia, and astigmatism, thus emphasizing that VKC is not just about irritation and discomfort to the child, but much more. Timely treatment and proper prevention of allergens may save the child from long-term harmful effects of VKC. Thank you.
Which grade of VKC did you include?
Ma'am, all the grades.
Do you think the grading would have also affected?
Yes, ma'am.
That
Yes.
would be one of the major limitations.
Yes, ma'am.
Also, what do you think would be the reason for inducing the refractive error in the case of VKC, especially in the case of recurrent VKC? What is the mechanism?
Ma'am, one thing is the changes induced by the T cells, and the main culprit, I think, are the mechanical trauma by the lids due to cobblestone, macropapillae. I think it is a biophysical trauma which is causing the changes, as the study suggests.
It is the obviously cobblestone is going to press and that will lead to, but it is the eye rubbing that leads to the trauma, and that induces astigmatism.
Yes, ma'am.
Why have you done this study when there are already studies which have depicted the relationship between VKC and ectasia, corneal ectasia? So what was the significance of doing this study?
Ma'am, no studies in my knowledge have compared mean spherical error, mean cylindrical error, and categorically divided them according to new cases.